Okay, call the meeting to order. As, what is this? Fiscal Committee. Welcome all. And I hope you have not had as long days as your House members have over the last 3 days. So we did finish up at 9 o'clock last night. That's why we're all here smiling. And we're looking forward to the things on the agenda today. The first item on the agenda is the acceptance of the minutes of February 18th, 2022. Are there any corrections, additions, changes? Seeing none, could I have a motion?
So moved.
Second.
Second, Senator Daniels and Senator Gaida. Okay. All those in favor, please raise your hand. Okay. Okay. 8 in favor and 1 abstention. Okay. Is there anyone that is interested in taking the tabled item off the table? Okay, seeing none, we will move on to the audit topic recommendation from the letter from Senator Reagan and the audit that is being asked to be approved is efficiency and effectiveness of the weatherization assistance program. As I understand it, we need 1 vote to approve this. So if there is, anybody have any objections? Okay, seeing none, then Tracy will vote yes. Okay?
Madam Chair, on the previous item that was tabled, 22-023, would you share with us your understanding of the status of that? I know it's tabled, but do we know if the department is working on addressing any of the concerns we had?
Yes,
Okay.
they are working on the rules.
All right.
Okay. All right. You ready?
All set.
Okay. Are there any items to come off the consent calendar?
Yes.
Okay, just a minute. Okay. Oh, let's do the whole, everything. Okay.
Off of number 9, I would like to remove 117 and 116.
There is no 117.
There's, yeah,
9 and 10, sorry.
I don't know what she's removing.
no. Which ones?
Off of item tab 9, 116, and tab 10, 117.
Page 3. Okay, we got it.
Okay.
We have those 2.
Okay.
Thank you.
Mm-hmm. Are there any others?
I had some, but I think Representative Emmerich has a punch list that.
Yeah.
Do you want me to read the list that we've had?
Yes. Would you mind?
Madam Chair, the items taken off in pre-fiscal meetings are tab 7, 22098, tab 7, 22100, tab 9, 22088, tab 9, 22099, tab 9, 22113, tab 9, 22116, and tab 10, 22117.
Okay. All right. Can we have a vote to remove these from the consent calendars area? All those in favor, please raise your hand. Opposed? All right. So, here we go.
Madam Chair, we need a vote now to approve all the ones that are still on the consent calendar.
Oh,
The other
okay,
ones.
yes. Could I have a motion to approve the remainder of the items on the consent calendar? Senator Rosenwald, second. Senator Gaida? Okay, and we need a roll call, right?
This roll call for the balance of the consent calendar. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
Okay. With a vote of 9-0, the remainder of the items on the consent calendar are approved. Okay, the first item that was taken off the consent calendar was 22098 from the Department of Education. Ouch. Let me find that.
For the record, Frank Edelblue, Commissioner of Education.
Kelly Rambo, Administrator for Nutrition Programs and Services.
Okay, tab 7. Okay, the question that we had on this is, we're not exactly sure what this transportation part of this is all about, and how are we, I mean, we just don't understand it. It's not, we're not opposed to it. We just don't understand how and what is going on here.
So let me try and clarify that for you, and otherwise Kelly can lean in on some of the details as well. But basically, we've received an additional source of funds from the federal government for our food and nutrition programs to be able to support our food programs throughout the state in some of the additional costs that they have incurred as a result of some of the supply chain issues that have happened in the across the country. So the difficulty in terms of getting, food and supplies to the school to be able to do it. Maybe they have to pay expedited charges, or they've got additional costs associated with that. And so these funds will essentially, other than a small part, be passed through to the districts to be able to support the increased costs associated with supply chain, constraints. Is that
Okay, so basically, the schools will ask for reimbursement for these extra charges?
Thank you for your question. So there is a certain amount, $5,000, that gets dispersed to every SAU, and then the remaining amount, is dispersed based on the meal counts from 2021. And the schools can opt in for this, and they can not choose to take the funds, and obviously that would change the amount and the formula that each school would get to.
Okay, so it's based on meals served?
Correct.
Okay.
other than the $5,000 flat
Right.
fee that everybody gets.
Are there any further questions?
I have a tangential question, if I may.
Certainly.
Thanks for coming in, Mr. Commissioner. I started a conversation with DHHS a couple fiscal committees ago. I had a constituent call me up. She works in a nearby school district, and she hammered me as good as I've been hammered in a long time about the extra burden that the schools were bearing in order to keep up with all the COVID-19 reporting. And I think that's primarily a Department of Health and Human Services task that's going to the schools. But I just wanted to make you aware of it and ask you if you were aware of the schools complaining about what feels to them as a truly excessive workload around COVID reporting.
And can I just clarify, are you saying specific to food and nutrition programming or broadly?
No, this is tangential. It's completely different. It's about COVID reporting. I'm just using the fact that you're up here on the nutrition to ask you about something you're completely unprepared for.
No, actually, I'm quite prepared for that, so it's no problem at all. Because there was a significant amount of reporting that was taking place from our schools associated with cases and contact tracing. Over time, that has come down, and on February 23rd, with the update of the recommendations by public health around some of the COVID protocols, the amount of reporting by the schools has been substantially reduced. And so there is some reporting that continues, but a significant amount of that burden has been taken away from them.
Thank you for the sidebar. I just asked because the constituent was so fired up.
Yeah, yep. So I think we've taken care of much of that. Thank you.
Okay, are there any further questions? Seeing none, will the clerk please call the roll?
We need a motion.
Oh.
Trying to get done very quickly.
Yes, I am.
Motion to approve.
Senator Daniels.
Second.
Okay, well, these official things, what do I know?
Okay.
Well, the clerk please call the roll.
Roll call on 22-098. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 9-0.
vote is 9-0, the motion passes. We now move to FIS 22-100, which is requesting $254 plus in Federal CARES Act funding. So, my question on this is that I had thought that all CARES Act money had to have been allocated by 31 December. And so I was just a little confused as to what was going on with the CARES Act money.
Sure. So I do believe that that applied to the CARES Act funds that were appropriated through Gopher. But there were many CARES Act funds that were appropriated directly to the department through that bill. And with this grant, it is good until September of '22. So the dates of when the grants expired from the CARES Act depended on where the funding was granted to, and this one was directly to the department. It was not through Gopher.
Okay. Representative Edwards.
It's kind of a two-part question. I'll ask it in one. It says that this is to support the survey and certification activities, and I was just curious if you could characterize what all goes into the survey, and then on the certification piece, what utility does that certification serve? Does it authorize receipt of funds from something, or why bother with the certification?
Thank you. For the record, my name is Melissa St. Cyr. I'm the Chief Legal Officer for the Department of Health and Human Services, and I oversee the Bureau of Licensing and Certification. Relative to this survey and certification, the question that you just had, and inspecting all aspects of quality and care that's provided to residents that live in nursing homes. So it's every aspect of medical treatment. It's all aspects of the environment, food service, everything that they possibly could be receiving treatment or care for at the nursing home. So these surveyors go in and do that. In doing so, if they found them in compliance with CMS regulations, they then are certified. That facility becomes certified to provide services to Medicare recipients and Medicaid recipients. So that's what the certification is for.
So, follow up.
Follow up.
So what would be the impact if If they didn't get a certification.
If they did not get their certification, they could lose all Medicare funding and not be able to provide services to Medicare recipients.
Could I have a motion to accept FIS 22-100?
I'd like to make a motion, we accept 22-100.
Okay, Senator Rosenwald seconds.
Okay, roll call.
Will the clerk call the roll?
Roll call 22-100. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
With a vote of 9-0, FIS 22-100 passes. Okay. I see that. Thank you very much. Okay, we're gonna go off on something else right now.
It's
Oh.
still DHHS.
No.
Oh, okay.
No. No, I didn't forget about it. He wasn't here. Okay. This is a perfect place to bring up our friend from DAS, Mr. Arlinghouse, Commissioner Arlinghouse. At our last meeting, Commissioner Arlinghouse promised us that by this meeting, he would have hired his 3 temporary positions for working to gain employees in the state. So that's my first question, is how are we doing on that?
So at our, I'm gonna take issue, not really, but I said, give me a month. Not a month from the date we were speaking, but a month from when we have permission, right? So our meeting was February 18th. The governor and council approval, which is required for this item, was March 9th. I can't post a position before March 9th. So we did a whole lot of work between this meeting and the council meeting on the presumption, and normally I don't let people do work on this presumption. If it requires fiscal and governor and council approval, just keep your shirt on until they both approve. Because you know, who knows what happens at governor and council? Obviously, you're a very reasonable, wonderful body, and but them, who knows? And they're a reasonable, wonderful body too, for the record, if somebody's taking notes. So that meeting was March 9th.
We won't put that in the minutes, okay?
Thank you, I appreciate that. So that meeting was March 9th, and we posted the position on March 10th. So, which is pretty good, I think. I mean, I suppose theoretically we could have gotten it up that afternoon, but that's silly. Position postings in the state process require they be posted internally for a period of time, typically 5 business days, and that was yesterday. And we are likely to extend the posting, although evaluate what we've so far, but extend the posting externally for 5 days. Don't 5 days, it might be 7 days. There's a standard work unit, and it might be 7 days because it's 5 business days. At which point we have, I actually asked somebody to pull this for me Wednesday. So there are 3 positions. We've received 4 applications. There are 1 or 2 of them that may or may not certify. They're reviewing it to make sure that they do. The certification process is moderately cumbersome in the state system, which is why we're probably going to go external. But we have, in the meantime, developed a recruiting and marketing plan, a general business plan, including metrics and goals. There is position work underway, pulling positions across state government and vacancy rates to figure out which positions that we're going to target first. I would describe that as underway, but the woman, the analyst doing that work for us, Carolyn Russell happens to be her name, is fairly far advanced on that. When we talked about it a week ago, she seemed pretty clear on at least about half the positions they're going to look at. So I would expect that we will have hired all 3 positions within a month of the governor and council meeting.
Okay, so you're tricking me.
I'm really trying hard to, yes.
Yeah, I got it. Okay, so next month in
So
April.
next month, I'll actually have names for you.
Okay, I don't
So,
need,
but, and it's important, I know my opening was a little bit silly, but it's important to note that just because those 3 bodies have not been hired doesn't mean that a lot of work isn't being done by people who already have too much on their plate. And so, this has been prioritized and is being worked on. I mean, frankly, not just by, Carolyn is a very personnel issues instead of the rest of the department because of the importance of this. But she has 3 other major projects that I'm constantly harassing her about. And the director of personnel is directly involved on this herself, and everybody else. The only person not directly involved on it is me. I just ask them what they're doing, and they tell me.
okay. One of our concerns, and the reason I asked you to come up now, is because we have the Department of Justice looking for an employee, and we have, was it HHS? The Department of Business and Economic Affairs looking for 3 people. And so that's 4 additional part-time people. And the concern that we have is that our vacancy rate, which I guess you had provided to us, this is just on full-time people, was at 18%. And I don't know that we know what our vacancies are on these part-time positions, or not part-time, but temporary positions. And so I would venture to say over the last 6 months or so, we've probably approved 25 or 30 and maybe more part-time, or no, I keep using that word, temporary positions. And we have no idea where those are on the hiring process, because every person that talked to us told us that if we didn't have these temporary positions, we couldn't do the work. And so, is the work stopped? Are we able to, you just said that even though you don't have these people, the work is still going on. But that didn't seem to be the feedback that at least I was getting from the other agencies.
Well, I hate to say that it's complicated, but...
Oh, I know it is.
But I'm
very.
going to. So there are a couple things. First of all, you Mr. Kane, nicely provided me the sheet. So this sheet, their vacancy rate is about 18% statewide. It's much higher among Class 59s than it is among Class 10s, right? Your full-time permanent positions is lower than that. The nature of a Class 59 is it's going to be higher because it's approved. It takes a while to find somebody. When you're in a tight market, it takes a long time to find somebody. Why do people ask for a position even though they have a vacancy? Because it's the state, and you have to. So I'm going to use an example. I have a vacant internal auditor, and I made a decision for about 3 years not to fill it on purpose, even though it's funded, because we had a lapse target we had to hit, and I needed to use that to hit the lapse target. I had to carefully look at and not fill. Let's say, for the sake of argument, you had said no last month, and you can't hire anybody to do recruitment. And I'd go, oh, you know what? I'm going to use the internal auditor to do recruitment. You're not allowed to. That would be illegal. I'm not actually, I can temporarily assign people to do things, but I can't hire I would hire somebody with an audit background because they have to have an audit background. That SJD has to be approved. The salary is set based on those duties, and you can't Like I couldn't have a building service worker being paid as an internal auditor. It's not permissible in the system, so I can't use that position for that. Some are more fungible, some are less fungible. It's very true on part-timers too. You know, I have right now in our department 48 or 49 vacancies among building service workers, which are mostly part-time, unlikely to ever go down because, you know, why would you clean toilets for the state when you could work at Dunkin' Donuts? And that's a thing. It doesn't help me in some other areas. So some of when an agency asks you for funding is going to be based on that they have positions that they can't repurpose for that. In addition to that, for some of the grant funding and things like that, I want to hire somebody into a position that is a class 59, not a class 10, because it is going to go away when the funding goes away. And I don't want to create a permanent position. I can't create a permanent position based on temporary funding. And so, you know, there's an element where this is sort of a nice thing for the employee too, that you're hiring someone in and you're basically saying to them at the front end, I hope you understand, and I'm being upfront with you, that this is based on a grant. It's why it's called a full-time temporary. If you do a good job and we keep getting the grant, we'll keep you. But it might go away in 2 years, and your position will go away in 2 years. So some of it is about what position is what position. And you look at it, there's also no agency, I suspect, sitting behind us who thinks, I'm planning an 18% vacancy rate for the rest of it. Everybody's trying to fill positions, obviously, and you know that. And they think, everybody thinks that next week I'm going to get lucky. And, you know, next week this is actually going to happen, and that the resumes that came in this week are not indicative of what's going to come in next week. That suddenly something's going to happen, and all those 26-year-olds who've decided they don't want to work anymore, they're going to wake up and decide they want to work. And I don't know that it's all 26-year-olds, but my understanding is that's a demographic that's hurting us right now. And so you're pushing and you're pushing and you're pushing. You know, we have some areas where we've had a lot of luck in filling positions, and I think to myself, you know, what hiring problem? And then we have a couple of areas where you know, computer professionals, for example, where, wow, this is really hard. So I think that's some of what goes on with positions, if that helps at all.
Senator Rosenwald?
Thank you. At a previous fiscal meeting, and I don't know if it was the last one or maybe the one before that, we were asked to approve 8 non-classified positions for Hampstead Hospital and appropriate some ARPA funds, I think it was, and we did that. But now there's a piece of legislation moving through the Senate that wants to add 6 unclassified positions and doesn't appropriate any money. So I think the money we appropriated in fiscal would pay for those 6 positions, but it feels to me like we over appropriated money and over created positions. Because what happens to the 8 non-classified positions we created?
So I can talk about the generics of that admittedly very unusual and rarely used process, but I suspect the specifics are, maybe we could ask Karen Rounds to come up. Oh, here she is.
Good morning, Karen Rounds, Chief Financial Officer, Health and Human Services. So the 6 non-classified positions that were created with that ARPA item, as Charlie mentioned, was a little bit of an unusual situation, right? We are purchasing Hampstead and need to stand up some of those positions even before we can get the operating budget to you. Those positions are currently posted. Those 6 positions are intended to be replaced by the 6 unclassified positions. So those 6 non-classified positions would be eliminated. And if it's you know, makes people more comfortable to put right into the Senate bill that these positions will replace those positions, that the department is completely agreeable to that. The reason that the unclassified positions are so important is that the non-classified positions don't have a salary grading system. They are positions that are authorized by the governor. And so we need to have the unclassified positions to go through the JCEC process and assure that we set the salaries at the appropriate place. Now, we have a pretty good sense of where they will land based on other positions in the department, but we want to make sure that those positions are established appropriately through that unclassified process and that the salaries are established appropriately. So that's the reason that we've set those up now, because we cannot create an unclassified position without going through the legislative process. So we are creating a non-classified position until the unclassified positions are created. Now, I know that there was some suggestion that perhaps we could wait until the budget process to create the unclassified position. I think the reason that I wouldn't suggest that is that the unclassified positions, once they're created, will need to go through the JCEC process, which can take several months. And so if those are created now in this legislative session, sometime in the next fiscal year 23, we will be able to move those people into an unclassified position, eliminate the non-classified positions, and then they will be established and properly budgeted in the 24-25 budget. As far as whether we've double budgeted the funding for those, no, we won't be double budgeting them. We will make sure that when we bring forward the operating budget, there is a balance between what we expect the unclassified positions to be completed by JCEC in the operating budget, and we won't be double budgeting those positions.
You have a follow-up? No problem.
Thank you. That is helpful, and I'm sure you'll help us write an amendment to Senate Bill 430.
I'd
But
be happy
aren't
to.
those positions, the positions we created here were non-clinical, and the bill's positions, I think, are clinical?
I don't believe so. They're intended to replace those 6 positions. I
Okay.
don't think they're specific in the bill as to what the position titles are, if that, correct, yes. So,
Okay.
but yes, we will get you some language to add to that bill.
Excellent. I'm sure Senator Daniels and Guida and I will appreciate that. Thank you, Madam Chair.
Okay. Are there any other questions for Commissioner Arlinghouse?
I have,
Okay.
thank you, Madam Chair. Mr. Arlinghouse, I'm looking at a document you may have seen, but it's essentially a spreadsheet of about 49 departments and sub-departments for which we have total and vacant full-time classified funded positions. It's something that Mr. Kane has handed out to us. Yes, okay. So back in the old days when I did some manpower analysis, I kept track of the space availability next to it, and I'm just curious what your process is for making sure that we have space to put these folks if we hire them all. You know, like, do you keep a red, yellow, green kind of process where we're red if we just don't have a future place to put them and green if everything's okay, or how do you do it?
We typically haphazardly is probably a good answer. That's not literally true, but space is assigned in buildings, and generally the way life works is the occupying army keeps the space that they've been assigned unless somebody has proof that they don't need it. I mean, once a department lays claim to a land area, sometimes it's hard to take it away from them. We will make adjustments, and statutorily that is my authority. And somebody said to me, "You can just kick them out of the building," and I'm like, "Yeah." And then I got to find somewhere for them to go, and you take space away from somebody, and they completely freak out because there's nothing more traumatic than moving your desk, right? And so we're careful about it. And so generally speaking, you know, if you're, I'm going to use examples in the annex. The Department of Agriculture has these rooms in this space, and at some point, if they start getting positions thrown at them in the budget, something might come up, and we might have to look at it and go, oh, you know what? We're probably going to have to move abandoned property for the Treasury over here and move them here, and kind of create a little bit of room for them. But until that happens, where there's an issue, we kind of let it go. We wouldn't keep such perfect track of their vacancies to say that, you know, based on what we're looking at, you've got 6 open positions. and you have desk space for them, I'm going to take Human Rights Commission and move them in on you. So we try not to do that. It's rare. It's what's typically the case is that an agency has enough space for the people they have, and they may do some internal moving around to make that work. Somebody who thinks he or she is entitled to an office, not that anyone's entitled, is in a cubicle, or vice versa. Sometimes it's like, I got an office because nobody was using it. And sometimes that happens. But it's sort of moving around. We're doing some work in the annex, or preliminary work now, but eventually it'll be chaos. And we were moving people around, and I had to take, for example, judicial counsel. You guys see Sarah periodically, and we had to move them somewhere. There were only a few places to move them because we were doing asbestos remediation where they were. And so actually my office and my assistant's office is where they are now. And I'm in a supply closet. It's not a supply closet. It's larger than that, and there's a window. So it's not really, but that didn't stop the Terry Paff and the Attorney General from mocking me last week for my office. But it's perfectly lovely. But we did that because, all right, this works. This is open, and we can put the copier here instead of here, and there's some fire suppression sensors on the wall, but I wouldn't mind knowing when there was a fire. And so you do some of that to sort of make it out. So we keep regular track, and when the budget passes, somebody in Joe's team does a position summary on where positions were added, and we keep track of that. And then we work with the people, our plant and property people will work directly with the agency to say, what's going on and because sometimes they'll know when the men's room leaks before we do. So. And we'll fix that.
Okay, thank you.
I know that sounds really organized.
It is. Some of us have done that for a living. Anyhow, I guess that this vacancy rate for New Hampshire, that was put together by you initially, correct?
Yes.
Okay. Can we add to this temporary positions that...
So this sheet that I'm holding up, there's a camera. I keep forgetting there's a camera. It says full-time classified funded positions at the top, and this is class 10 and 59. And I can get you data that breaks it down by the 10s, and the 10s are the full-time permanent, 59. I mean, you're all the budget people. You're actually the people who know this. And the full-time temps, and I can break it down by those two.
Oh, okay.
And you'll see the one is slightly lower because it's the 10s, and the 59s are higher in part because there's occasionally a long lag after they're created before they're filled.
Okay, thank you. I didn't realize, I don't think any of us realized that this included both.
Oh, I'm sorry. Yes.
Yeah, okay.
So the reason I know it included both, so I'm sure you know that I didn't do this myself. Actually, the person who did it is Carolyn Russell, working with FDM. And I took our department and tried to validate it. I thought, all right, what do I think our vacancy rate is? And I went through it, and I'm like, wait a minute, why am I getting a different number? And then it's like, oh, she's including the 59s. Okay, here I am. And then once I got there, I thought, okay, this works. Because I know from hiring that it's actually right.
Okay.
I mean, it's, technically out of date every time we hire somebody, right?
Right,
But
understand.
not much.
Okay, well, I thank you, so you'll be back next month.
Madam Chair?
I'm here every month whether you want me to be or not,
Yeah.
statutorily.
You're right, except you were late today, so.
Well,
Madam Chair?
I was at Ways and Means, just for the record.
I have one more question for you.
Oh, sorry. Ollie,
Thank you,
good.
Mr. Arlinghouse. So one of the things I couldn't find was the vacancy rate for part-time positions. I have lists of part-time positions. Is that something that you track?
It isn't, and let me explain why. An agency, if it wanted to, could sort of do a part-time vacancy rate, but it's sort of for this reason. When you do budgets, part-time positions are placed in class 50, and you're not assigning positions. So the budget that you do is budgeted by position. I mean, literally, if you go in the background of the system, there's a position module, and there's a specific number of positions assigned to very specific things, and those positions are created in the system, so they exist. Part-time, functionally, what you do is you say to an accounting unit, here's $100,000 for part-time workers. And there's a basis for that. The agency, in developing the budget, will do sheets in the background to say, well, Fred makes this and Tony makes that. We do it, obviously, every accounting unit for building service workers who are mostly part-time. And there's like, Beth made 12 grand last year and Patty made 14.6 and Kim, you go down that list. But technically, I could hire 2 people at 6 grand instead of 1 person at 12. Okay, what you're doing is appropriating money to me to spend on part-time workers, as many or as few as I want. Technically, non-classified is the same thing, right? You created non-classified positions. Well, in the budget, think of the governor's office, which is really where the only non-classified positions are, or were, and will be again. You just give him a chunk of money, and he can pay anybody whatever he wants, because it's a political office, not a administrative office, right? And so I said to him once that this is when I worked there, I said, you could pay one employee $500,000 if you wanted to. I'm not telling you which one it should be. But it's technically true, right? It would be weird, but it's true. And part-time is the same way, that there's a part-time money allocated, not a position. So anything I told you would be vague.
A follow-up? So when we create these part-time positions in fiscal, how do we ever know if they're getting filled and doing what they're supposed to be doing?
I mean, in theory, when you're going through, and this typically happens right at the division level in finance, when you're going through the finance process, there's a lot of reporting. A lot of it you wouldn't necessarily know. You don't necessarily need to know on the part-time money in particular, because I think the thought process in the past had always been, I'm going to authorize you to do this. I'm going to authorize you to do it with part-time workers. And the distinction really is that we're not paying benefits, right? It's not really more complicated than that. And because of that, I'm not really worried that you might be paying somebody too much money or out of whack, because they are going to be created. They are going to have an SJD in the system. They are going to be part of that. So they'll match the system that way. I just want to know if you're going to get it done, and it'd be too much to manage. So you've agreed to less oversight, but you can always ask.
Okay, so I'm not worried about the money. I mean, I know it should be, but that's not what I'm talking about. I'm just about the job getting done in a lot of these ARPA positions are coming in that way, and then we never hear. Okay, well, some of these positions in that big spreadsheet are part-time. Maybe ARPA's the wrong thing, but.
So, I mean, we can get back to you periodically on position counts, but if you think about the vacancy sheet you have, for example, the 17.7%, you don't know exactly which position and which person does it. So I think it's hard. I think anytime, with any project, I think we're in a system where any commissioner, director, or state employee would feel like a question from fiscal is one they're required to answer. And that would happen. And I know our sense on our ARPA stuff is that there will be not day of reckoning, what's the right term for that? An accounting that we have to do for it, right? That we have to come forward and say, this happened. And, if I have a position, I'm going to try like hell to fill it. I mean, I have a 400 people, well, vacancies, so 300 and some, who are working their tails off and struggling, right? To get, I talk to the cleaner on my floor every night, and we have conversations about, she hates the cleaning product we buy. She thinks it's colored water. We need something with acid in it. I know more about cleaning products than I did 5 years ago. But because she's trying really hard to get stuff done, and she's like, well, we don't do that anymore on Wednesdays because I don't have time. And so if I got a position, there's nobody in state government who doesn't want to fill it, period.
Okay, thank you very much, and we will look forward to hearing from you in April.
As will I.
And I really, really appreciate it, because this is something that obviously concerns all of us, that we are approving so many temporary positions to do specific work, and we have no clue as to whether or not it's getting done, so.
We're from our, just so you know, from our standpoint, we're very eager about this too. This is an area where I think, and I speak for everybody probably in HR in the state, but we think we can really make a difference in helping people. It's a struggle for everybody. Probably it's a struggle for every business in the state, right now. But it's a struggle for everybody, and you know, pitching ARPA on this, the idea was to try to help people. And you know, the thought was, you know, where can we make a difference for agencies? And you know, nobody sitting behind me is going to raise his or her hand if I say, raise your hand if you found it easy to hire. So we're very optimistic that good things will happen.
Okay, thank you. And the reason that I asked Commissioner Arlinghouse to come up is because although we have basically approved already 22-104 for the Department of Justice, they are looking to hire a temporary full-time position. And so I think we have a better understanding, hopefully, of what's going on out there. And, you know, don't be surprised over the next several months if we don't continue to ask questions about vacancy rates. Okay. The next item is FIS 22088, tab 9. Pardon? Okay. Welcome back.
Thanks.
Representative Edwards?
Thank you, Madam Chair. I think this is going to be an easy one. In the middle of the first paragraph on the second page, it says that the activities supported under this award will include, and here's the key word, continued development of streamlined approaches for the collection, blah, 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 blah. So my question there is, it sounds like some streamlining has already taken place and we're going to continue to streamline. Can you tell us how much more efficient has this first year made us, and what do we think the potential for streamlining is in the second year?
Sure. Good morning. For the record, I'm Ian Watt. I'm the Deputy Director for the Division of Public Health Services. So, you know, in looking at our processes, we're obviously always trying to be more efficient in both accepting information with our internal systems and how we aggregate that information. The volume of data that we've received, you know, throughout the pandemic has obviously exceeded anything that we have historically had to take on. So, you know, I can't speak to specific tactics we'll be taking moving forward, but we are always looking at how we utilize staff, how we utilize systems, and how we accept information. You heard earlier from the Commissioner of Education that the information we're getting is evolving, both how much and the exact data that we're receiving. And so we'll continue to look at, as we receive data reports, how we accept them and how we use that data for our public dashboards and some of that de-identified data that continues to be useful for the public.
So I pulled that out because it just seems like it's an inherently hard thing to have performance metrics around. How much development have we done? How much more do we have to do? It's kind of hard to say. So I'm just curious if how you're monitoring or measuring it so you feel like you're being successful in this area.
Yeah, so, you know, we receive both case reports. I mean, this item specifically refers to travelers' health, and I'm speaking more broadly when I speak to data. We receive case reports on a daily basis through various forums, and, you know, our intent is to get through that data, aggregate it, and produce public information as quickly as possible. We have, at various times in the pandemic, you know, had varying success just given the volume of cases that have come in. So, you know, our expectation going forward, given the you know, lessening of cases in the community, would be that we will be able to continue to meet that kind of semi-regular deadline, either daily or semi-daily, to be able to report a full case count and completed reports. We don't have a clock on ourselves in terms of an exact timeline to report that data. We try to be as efficient as possible with the staff that we have, obviously relative to the case counts that we're receiving.
As I was reading the department's set of materials here, one trend that I've seen, and I don't know, Ms. Rounds, if you're responsible for this, but I really appreciate that I think y'all are anticipating the kinds of questions we're going to ask. And so I just think in this document and the subsequent ones, I just appreciate that you guys are putting in the extra work to be clear on what you're doing. So thank you.
You're welcome, and the credit for that definitely goes to the program directors and the finance directors.
Okay, I have one question, unless someone else has a question. Okay, yes, go ahead, please, Senator Daniels.
Thank you. Could I get clarification under the requested action in there of the word mandated? When it says protecting the health of travelers and communities in a global mobile world project as mandated by ARPA. Is it, I'd like to understand how the word is used. Is it saying that ARPA is mandating that we need to have this program? Or is it saying that, you know, that there's a program and that there's something within ARPA that tells how it's going to be used if it's accepted?
Yeah, so thank you for the question. So this is language that we've used and has been used throughout the pandemic with funds accepted through ARPA. So should we accept this funding and activate this program, we're mandated to utilize it for the intentions of the program as outlined in the Rescue Plan Act. So, you know, we're not mandated to activate the program. We're certainly mandated to use the money as intended by the federal law.
Thank you.
We also had a discussion in our group, and as we understand it, you go out and apply for the money, and then they either agree or disagree. And so really what we're doing is we are required to spend the money for what you have asked for, or what they have sent, or whatever. So from my perspective, it would seem to me that it is the mandating is for the fact that you got the money and you're spending it. And to me, mandating means they told you you had to go and get it, which is not the way I understand the program works. So from my perspective, I would prefer a different word like required. And not, because it's not you know, the only reason it's mandated is because you went and asked for the money and you have to spend it. So, you know, they don't, when you come in for other non-ARPA money, I don't think you use the term mandated. I think, you know, so if,
We can certainly make that adjustment.
you know, if that's okay, you know, it's one of those things that sometimes get people's hair on the back of their neck up. Okay, yes, I do have one question on this. And not that it's a huge amount of money, but it says you're going to purchase the Canva software. And since this is all contract, I didn't understand why the department needed to purchase the Canva software.
Yeah, so the staff member identified in this item, you know, may have the need to develop some kind of quick graphics for our social media accounts or reporting or other kind of public information. And the Canva account, which I believe is about $120 annual license, will allow them to do that on demand without consulting or using a vendor.
So this is not necessarily just for this program, is that correct? You're just financing it out of this program, I hope?
Well, we would certainly utilize it for traveler health information that we disseminate over social media
yeah.
and otherwise.
I got that.
It would certainly be extensible. I mean, the license isn't limited to just this work.
Okay.
Madam Chairman, I move to, that we ought to pass on 22-088.
All right, do I have a second? Senator Rosenwald, thank you. By the way, maybe I'll come over and attempt to use your Canva software. Sounds interesting.
Please do.
Pardon?
Oh, I just said please
Oh,
do.
please do. Okay. Go ahead.
Roll call on 088, Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Yes. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
Thank you very much. On a vote of 9-0, FIS 22088 is passed. Okay, now we turn to FIS 22099. We're in the same tab, tab 9.
May I, or did you give me permission?
Not yet. Okay, you have, Senator Edwards,
Thank you.
Representative Edwards, you have a question?
Thank you, Madam Chair. And this is sort of similar to the mandate question. Are we using the right term? And I'm glad we had that conversation because this was the first time I noted it on this. But on the second page, there's another word here that I think may be improperly used in the context, and that's the word infrastructure. It says, on the second sentence towards the end, it says, we're going to build and maintain infection prevention infrastructure necessary to support blah. So what, to me, the word infrastructure means we're going to buy something that's going to be persistent. And everything I read in this makes us feel like it's just temporary or transitory, and we're going to get a temporary capacity, perhaps. But the word infrastructure jumps out. Can you talk to that?
Yeah, so in addition, I think you make a good point. Certainly the resources in terms of people would be kind of transitory or temporary. Public health education we consider a fairly durable good and part of the fabric of public health in the community and in these facilities in terms of infection control management and just information around COVID-19 and other transmissible diseases. So we consider that an infrastructure investment in these facilities that they would get on a long-term basis, but certainly point taken about kind of the physical assets and commitment that way.
All right, may I?
Yes, follow up.
Yeah, sometimes budgeteers fall into using words that's being funded currently, and infrastructure is a good hot word to fund, but if we could be precise there, that'd be better for me. But all right, so it says in the second paragraph that you're monitoring the indicators, and so if I were to ask, I'm not asking, but if I were to ask for a list of the indicators that you monitor, could you produce such a list?
Yeah, so in putting forth a similar program over the course of the Omicron surge and what we saw this past winter, we monitor a number of patients, patient throughput and the ability to care for individuals, how many people we can get out of hospitals efficiently to ensure that the healthcare system is functioning. So we would have information like that regarding what this investment helped facilitate within these facilities, and then in turn how they help the healthcare system.
All right, thank you for the answers, and thank you, Madam Chair.
Senator Rosenwald?
Thank you, Madam Chair. Will you be able to include the veterans' home in this capacity building work, public health?
So I actually don't have that answer offhand. We have worked with both county facilities and private facilities and others. I don't have in front of me, and I don't have that knowledge in my head, unfortunately.
Okay. Could you please get that back to us?
Absolutely.
Okay.
I'd be more than happy to.
Yeah, thank you. Just send it, if you would, to LBA, and they'll get it out, because I think it's an extremely important area. Is there any Representative Erf?
Thank you, Madam Chair. I have some sort of broad questions about the effectiveness of the program. I understand that some nursing homes didn't choose to participate. The reason being that there's a fear that they get these patients in out of the hospitals with the strike team, then the strike team leaves, and then they still have the patients. So I'm curious as to how many nursing homes participated, both county, broken up by county and private, and how cost-effective has the program been in terms of actually getting patients out of the hospital into nursing homes, and then being able to continue to provide service, the nursing homes continue to be able to provide services to those folks once the strike teams are gone? Because I believe this is the second or third go-around of this type of program.
So I did receive your questions earlier this morning and chatted briefly with Chris Santinello, as did Ian. Unfortunately, she wasn't able to be here this morning, but she is preparing all that information to provide to you.
Thank you.
You're welcome.
Okay. We'll all be interested in seeing that. Okay, are there any further questions? Could I have a motion to accept FIS 20, excuse me,
99.
22099?
So moved.
Second.
Okay, Representative Erf and Representative Edwards. Will the clerk please call the roll?
Roll call on 22-099. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
Vote being 9-0, FIS 22-099 is approved. Okay. We now move to FIS 22113. And that is in tab 9 as well.
Thank you.
Questions?
I had a question. I just need to get my piece of paper out. You can come back to me if you're willing.
Okay. Representative Erf?
So, a few questions. This runs through 2026, but I guess the funding is only through this biennium, the $4 million or whatever it is. I'm kind of curious, is this going to be a long-term, we're going to have this huge space ongoing into the future, or is this kind of a temporary thing that's COVID-related? It seems like a lot of money for a big space.
So we have, thank you for the question. So we have, at this point, a lot of durable items, PPE, testing equipment, durable medical goods like ventilators, ventilator equipment on hand. And we have that on hand, anticipating what we've seen this past winter. We obviously don't know what the future holds in terms of COVID-19. We are in a good place right now in terms of case counts. We do anticipate case counts will increase in the future. We don't know to what level. We don't know on what frequency. So, the idea of the stockpile of goods in this warehouse is to have us have supplies on hand that allow us to endure the same breaks in the supply chain that we've seen over the past 2 years. Obviously, in 2020, we were in a position where we weren't able to get almost anything. We were getting kind of single goods one at a time. This winter, we saw the same challenges related to gloves, related to N95 masks. So the intent is to make sure that we can continue to provide a continuity of services to healthcare facilities, to schools, to correctional facilities and others, to make sure that we continue to be able to operate life as normal here in New Hampshire. In terms of, long-term past the 5 years, our intent would actually be to be evaluating the space on an annual basis, and that's included in the lease. I don't anticipate we would not have any space before the end of 5 years, and I can't project, past 5 years, obviously not anticipating where we will be with COVID-19 or any other challenges we may endure between now and then. But certainly it's a continuous evaluation on our part of what is necessary to react to and be prepared for future events.
Thank you.
I have my paper now.
Representative Edwards?
Thank you, Madam Chair. So I had the same question about the long-term nature of the space, and it's altogether about $3.9 million, which just feels like a lot of money for 2 street addresses for a year. And so I'm guessing that because this was an urgent need, we didn't go out for bid. And I'd like you to confirm that. And could you tell us who the property owner is for this piece of property? I assume it's one owner because it's 19 and 23 Terrell Park Drive in Concord.
So what I can tell you, having been at the Emergency Operations Center when we first procured this space, is that we did look at several different spaces at the time. You're correct that it didn't go out to bid because it was an emergency at that point. We had PPE coming in and needed a place to put it. But I can tell you that the price was competitive. I don't have the name of the owner, but I'd be happy to get you that information.
I'd appreciate it, and also if you could give me some idea what the ballpark is on the cost per square foot for the rental.
Sure.
Because I have no clue how big these facilities are, but that just seems like a lot of money for a year lease.
Yes, we can get you that information.
Okay. Thank you.
Thank you, Madam Chair.
Are there any, Senator Rosenwald?
Thank you. So if you're going to keep this space through the next budget, are you going to be looking for $8 million for the next budget?
Potentially. So that's something, as Ian mentioned, we'll be evaluating each year. I believe the letter said by May 1st of each year. So that does allow us to adjust the budget in the Senate phase if we needed to, based on what we would need going forward. But I expect over the next 6 months, we'll also have a better sense whether we see continued surges and what they look like, and like Ian said, what the needs of the based on the supply chain are. So I'm confident that before we're closing on a budget, we'll have a pretty good sense what is needed.
Yes, please.
Thank you. So you're storing ventilators there that the state owns, or do the hospitals own the ventilators and you're just storing them?
So we have a variety of goods there. So in 2020, obviously getting ventilators was extremely difficult, and the federal government, out of the Strategic National Stockpile, distributed ventilators to the states. So we accepted that equipment on behalf of New Hampshire and then distributed it to facilities for their needs. We have seen, because some ventilators and some ventilator parts are not renewable, they need replacement or they need to be used one-offs per patient, excuse me. We have additional equipment, all of which actually was distributed during this past winter surge. Some of that equipment the hospitals may maintain for ongoing needs, based on the demand that they've seen. Some of it will take back and store again for distribution should it be needed in the future.
Thank you.
Thank you.
Yes, Senator Daniels.
Thank you. Karen, did I hear you say that it was expected in the next budget that you would be asking for money for the storage?
Potentially. We would, of course, always first look to any federal funds that we might have available to continue to pay for it. As you know, we haven't even started the agency phase of the budget yet, so it's not something that I've, sat down and talked with anyone about, but it's something we'll need to evaluate.
Okay. Follow up?
Yes.
So how do you reconcile your answer with the statement that in the event these federal funds become no longer available, general funds will not be requested to support the program?
So this request is only through the end of this biennium. So that is true for this biennium. When it comes to the contract, when it goes to GNC, that contract would look differently. But with regards to this request for the funding for this biennium, we would not request general funds.
Okay, so for clarification, that statement then only pertains to this biennium, not the total amount of time that the federal funds are available.
Correct, because you are approving you are approving us spending these federal funds, which we are saying we will not replace with general funds. You're not approving the contract. We just provided information on what we anticipate the contract looking like.
Okay, thank you.
And it does say in here, Senator Daniels, that through December 2026 near the bottom of page 2. Because that's when the ARPA money runs out, I think. So.
Well, Madam Chair, that's what I was talking about, but that's why I'm a little bit confused, because what I'm hearing is that statement that no general funds will be requested is only for this biennium.
Right.
But you're talking about a date that is out in 26, and
Yeah.
I'm just kind of curious as to what happens when, this one-time money drops off and we've still got loads of stuff that's stored.
Right.
How is, what are we going to do with it? How is it going to be paid for? things like that, if you're not asking for general funds.
Yes, and as Ian mentioned, we absolutely plan on evaluating this annually, and if we did need to reduce what is being kept to reduce the space, that would require an entire plan, which we would have.
Anyone else? Yes. Representative Edwards.
I just want to say to you, and you probably look at it the same way, I look at $4 million a year as being more than half of what we would want to spend on an adult dental Medicaid program. And so renting space and doing direct health care, I just want to keep our priorities straight, that we minimize, our investment in logistics, particularly when we're just renters.
Understood.
Okay. Are there any further questions? Okay, I have a question. I know you mentioned what's it called, the Federal Strategic Reserve, whatever it's called.
Yep, it's the strategic national stockpile.
Okay, thank you. Does the state have a requirement to have a strategic stockpile?
So the strategic national stockpile, actually, it's part of a federal program that requires us to be a conduit should there be, a major biological event or other event that requires us to distribute certain supplies. We have other facilities around the state pre-identified where we'd be able to stage and actually distribute to people in need of, whatever it may be, medication or otherwise. So we have a space, and this is something that predates the pandemic as well. We have a requirement to have space available to accept that shipment.
So we don't actually have to have anything on hand. We just have to be able to accept it from the national program.
Yeah, the strategic national stockpile does not obligate the state to hold a stockpile.
Okay, but it does obligate us to have a distribution center.
It obligates us to have the ability to accept goods to be able to distribute them.
Okay. Now, you may or may not know that I spent 28 years in logistics. And so this is a logistics question. What are your inventory procedures and your in and outs and replacement? Do you have a system, or are we just doing something? I don't know what.
So that's a very good question. Thank you. So
I don't want to say that, because I know as a logistician I never did anything haphazardly.
So we have, obviously the pandemic required us to stand up this capability to a scale that we had not previously executed in DHHS. We used an existing system called Juvare to manage our inventory. We have a full-time logistics coordinator who has been a part of our staff. I believe the position has been funded for about a decade. And that person is responsible for maintaining that inventory. They have 3 contract staff currently supporting them. In terms of your point about ins and outs, it is a question top of mind for us as well in terms of turnover of the equipment. Some of the equipment does have expiration dates. We're actively looking at those questions now, partnering with the hospitals, turning over equipment to them for their use so that we don't have stale equipment. Yes, so all the questions are certainly in mind, and we're actively pursuing them as possible.
Because I certainly don't want to end up in the situation that we did when the first part, COVID pandemic, where the stuff that was in the strategic stockpile was outdated, broken, whatever else.
And I just wanted to add to that, we also have to provide an annual inventory for the ACFR, formerly known as the CAFR, to the Department of Administrative Services.
Okay.
So we do that as well.
You had a question? Yes.
Yes, one additional question, please. I know that we have state buildings that are vacant. Why can we not use those buildings as opposed to spending this money on renting?
Charlie?
Question for Commissioner.
You can take it. You're so welcome.
We don't have state buildings that are vacant in that way. The state space that is habitable is all habited. There are some buildings on the campus, for example, that are relatively vacant. Think of Kent, that's attached to the back of main building. But to give you an idea of what kind of building it is, when I walked through it, when I first became commissioner, the direction was don't look where you're walking, look at the floor, because you don't want to step on the holes. and be careful before you take a step to make sure it looks like it looks like it'll hold. And the piles that look like bird droppings and raccoon droppings are. So that building is vacant. It's not suitable for stockpiling medical equipment. There's a thought people have about how we have lots of empty and vacant buildings. The state has since Representative Calawa was from Litchfield was on the committee in the late 90s, has been aggressively looking at redoing buildings. For example, that campus, there's nothing vacant anymore. That's structurally sound. There are some buildings that are in the process of being converted. Bancroft is the only real example of this, where, yeah, but it's not suitable for a warehouse. We don't have warehouse space. What we typically do is we convert anything we have that somebody can go in, we stick somebody in, because we're currently renting, don't hold me to this number, but something like 250,000 square feet of office space around the city of Concord. So there aren't really vacant spots that anything can go in. During the pandemic, I don't know any of the details on this, because I have very smart people who worked on it, and I don't know any of the details, but worked with HHS on finding warehouse space. And we didn't have any of our own. We just didn't. Like, I literally can't think of a big room somewhere that we could stick stuff.
No, I was just questioning, and Bancroft came to mind because we were out looking at space when we talk about the psychiatric hospital and other things regarding mental health. And I know it wasn't being used. I mean, I'm not sure if it's not, you say that it's not appropriate. I'm not sure why. It may be that it needs renovation to it, and then there's a question as, well, should we maybe take the money that we would be spending on renting and put that into renovating a building so that we've got something that we can use for something else when we're done using it as a warehouse. So I'm just trying to look at the other options, and
I think that's actually not a bad thing to do at some point. Look at that. It's a longer term rather than shorter term. That is to say, it probably won't solve needs in the first year or two, but just at Bancroft for an update, because I know there's a lot of interest in Bancroft because of the nature of that building and people who have been to it, and I doubt anybody's been in it recently, but the last capital budget item secured it from the weather, right? In a building's lifespan, it reaches a point where if you stop working on it, it's going to become like Laconia, let's say, where the question is how you tear it down, not if. And the policymakers made a decision 3 years ago to decide that we probably don't want to tear it down. So we fixed the roof, and we fixed a lot of the, things like caulking, so that when when I toured Bancroft the first time, it was a rainstorm. And the guys who were showing it to me, I remember Doug Burnham in particular, he had a notebook with him, and he was excited because he, aside from knowing where all the ghosts are, he now knew where all the leaks were because it was raining. And he's like, okay, there's one there, and there's one there. Hang on, just let me finish this. Let me finish writing in the leaks before we talk. And so we're fixed that. But in terms of, like, let's say you wanted to put a psychiatric facility in there, lots and lots of millions of dollars to turn it from, because there's lead paint and there are some holes, but it's externally protected to keep it from falling apart.
thank you.
Okay, thank you. Certainly.
Thank you. I sort of was thinking about Senator Daniels' question. I think I read that it's the intent of the governor to destroy, plow under the Sununu Youth Development Center when it gets emptied. And that's just a lot of building there that seems to have repurposed potential. Are we going to actually do a business case analysis on whether or not we can repurpose that building versus just destroying it?
Can we get that information back to you? The director of DCYF isn't here today, and I think he would like to be part of that conversation.
That's fine. I don't think we're going to tear it down this week.
Okay, could I have, are there any other questions? All right, could I have a motion, please? Oh, I'm sorry, Senator Gaida. I didn't see your...
Thank you, Madam Chair. Just based on the last set of comments, would it be appropriate to do a a tabling until we can find out whether Sununu might be usable. I've toured that building. It's in pretty good shape for the most part, the parts that are not being used. And I'm wondering, would it cause any harm if we were to table this until we got DCYF's answer and perhaps coordinating with Charlie?
I'm sorry, I didn't understand that Representative Edwards' question was, could we use that space for warehouse space?
Right.
I didn't, that was what you were implying?
I was more generic in repurposing the building because it's got specialty spaces that might be good, suitable for a similar use.
Right. Although the square footage is, significant in some areas of that building, I don't believe it would be conducive to storing equipment. There aren't elevators that go to the second floors of some of those areas. There are many, small rooms. I'm not sure that would make sense as a warehouse space. I don't think you're going to get a different answer from anyone else at the department, but if you want me to provide it in writing, I can certainly do that.
My question is more to the members of the committee. Do you think it would be appropriate? Okay.
If you want my answer, it's no. Okay, but could I have a motion to approve FIS 22113?
So moved.
Thank you. Second?
I'll second it.
Okay. Don't all jump at once. Representative Emmerich, will you please call the roll?
Okay, roll call on 22-113. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Yes. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
No.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 8-1.
Thank you. The vote being 8-1, FIS 22113 is approved. Moving now to FIS 22116 from the Gopher office. Good morning. We have some questions on this particular item dealing with the Veterans Camp. I don't like that name. I think we ought to call it the Veterans Air Base. Or the Veterans Ship. I don't know. Senator Rosenwald.
Thank you, Madam Chair. I do have a few questions on this item. My understanding is we're not going to own this site. Easter Seals is. They already own it. There's not a competitive bid contract. We're going to spend $23 million in a lump sum not specified. So my first question is, do you have any kind of plan you could share with us? And my second question is, does this obligate the state, any state program in any way that's going to be a budget expense that we should be thinking about the ongoing operational cost or contract cost?
Well, to answer your question, this request today is the accept and expense so that we can continue.
Excuse me, would you identify yourself?
I'm sorry, Taylor Caswell,
okay.
the Executive Director of Gopher. Now,
Thank you.
this is the accept and expense so that we can continue to work with Easter Seals on the final provisions of this plan. But in concept, this is a project that will be sort of the crown jewel of veterans services and housing available on a single site, 15 acres in Franklin, that the Easter Seals does currently already own. With regard to the competitively bid component to this, this site is ideal in every way for this type of a project. Any funding that ultimately makes its way into a contract, which would have to be approved prior to any of this actually being spent on this project, would still have to comply with all of the federal procurement rules, federal environmental rules, and so on that are applicable under the American Rescue Plan Act.
Could I follow up?
Please.
Thank you. But these are essentially state funds because we're accepting them. So what is the state's oversight going to be on this project? And then there was the second part of my question.
Okay, so this, I mean, the way that this would work is that these are federal ARPA funds that we would accept and expend, be available for us to continue to work with Easter Seals to make the final designs on this project, which would ultimately come up with a contract in which all of those issues would be addressed prior to any money being spent. And I would say that this is designed to be funding exclusively for the development and construction of this project and would not be used basically because due to the simple fact that we can't obligate funds beyond 24 and spend beyond 26, that this would all have to be done within that time frame. So it does not envision in this particular component of the funding the operational costs that would go with this, and those would be exclusively on Easter Seals for the operation of that project, just as they do, a lot of other projects around the state.
Thank you.
Are there further questions? Senator Daniels?
Thank you. In choosing the property in which to put this camp, how do you go about competing with other projects that the state has going on, for instance, relocation of the Sununu Center?
I'm not sure that there was an analysis that compared it to that particular site. I think this is a situation where we have an owner that has, that we are well familiar with, that has done housing development and services for different types of populations in the state, that owns a site that meets a lot of the criteria that you would look for in a site like this. And so, as I mentioned, this would be a project that ultimately would fall under all of the federal competitive bid process for the actual construction of this project, should we get to that point.
Thank you.
If I could, so what you're saying is that the 23 million will be spent on the facility, but not until a contract is approved by GNC.
Correct.
Okay, so you're just getting the money up front so that you can do something with the contract. Is that correct?
Well, yeah, I mean, it makes it a lot easier for Easter Seals to make commitments of their time and energy and resources if they know that the funding is available for the completion of the project, if it actually, comes to that.
Okay, thank you. Representative Edwards, you had a question?
I withdraw it.
Okay, thank you. Are there any further questions?
Move approval.
Okay,
Second.
Senator Daniels moves approval of FIS 22-116, seconded by Senator Gaida. Will the clerk please call the roll?
Roll call for 22-116. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
No.
Representative Umberger.
Yes.
Madam Chair, the vote is 8-1.
The vote being 8-1, FIS 22-116 is approved.
Madam Chair,
Yes?
may I ask Senator Rosenwald what her, no?
No. You can
Okay.
ask it afterwards.
It would be
Yeah.
fascinating to know.
Never mind. Later. Okay. All right. Now we move to Commissioner Caswell's other hat, which is 22-117, Department of Business and Economic Affairs. Someone from the Senate had some questions on this. Okay. Thank you. Senator Rosenwald, when you get your...
Yes, I'm at the item. Thank you.
Okay.
And thank you again for taking my questions. My understanding is that you want to hire these 3 positions to work with the existing housing agencies like New Hampshire Housing Finance Authority. I'm wondering first if your intention is to use all of the housing money to provide workforce housing, and would that be within the statutory framework that the state has for workforce housing?
So in terms of the programs that I think the governor referred to in his State of the State address, the $100 million intention on that, the details of those programs are still being worked out. And in fact, I think some of what we're trying to achieve is to bring in someone who's going to be ultimately responsible for potentially running that program to assist in the final version of all of that. I think it's very much the stated intention of the governor to have this funding be focused in the middle income category. There are many different sort of linguistic gymnastics that people perform when it comes to affordable housing. And I think our goal with this will be to accelerate and make more efficient the process of moving as many units as we can with this funding. The bulk of which we would want to see be in that middle income category.
Could I ask a follow-up? Thank you. And that leads to my next question of, does BEA, is it your understanding that the Treasury rule allows that funding to be used for affordable housing and not only market rate housing?
Yes, ma'am. We would be qualifying this program most likely under the revenue replacement categories, which would allow us to be able to have some level of flexibility in getting the funding into those types of projects.
Thank you. Thank you.
Are there any further questions? Seeing none, could I have a motion, please, to accept FIS 22117?
Move to approve.
Seconded by Senator Rosenwald. And good luck finding those 3 people.
Yeah, I know.
And you were another reason why Commissioner Arlinghouse was here, because I'm very, very concerned about all of these positions that we're approving month after month after month. So, okay. That's my, I know.
Roll call on 22117. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
Vote being 9-0, FIS 22117 is approved.
Madam Chair?
Yes?
We approved FIS 22103 on consent. I had a couple of questions if I could ask them, even though it won't affect the vote.
Is this something you personally want to know, or is it something the committee needs to know?
I can't speak for the committee. I think it's relevant to this program, though.
All right, one question.
Okay, so 103 is essentially a program that enhances our STD monitoring and remediation, and it's associated with the fact that because of COVID, it implies there's been a surge. And so my question is, do we know what the correlation between STDs and COVID is? Because I would think the opposite has happened. STDs have gone down in social isolation.
So I think it would be best to get you that information where most of the public health folks have left, unless you have that direct information.
Hi, thank you. For the record, Ann Landry, Associate Commissioner at DHHS. Thank you so much for your question. I would agree with Karen that we can provide that information in more detail. I know there's a lot going on right now to update some of our information that's come in on STD rates. but just tangentially, there are some that have increased, but then as you predicted, some took a dip in 2020 because people weren't seeking care because of the pandemic during, the stay at home and that piece. So now some of those numbers are starting to rise as well. But as you know, Director Tilley has all of that information inside and out, and she'd be happy to provide a detail if we can send that to you in writing.
Well, thank you for that. I just, what my concern there is that we're staffing up for what may be a period of decline in STDs, and then with COVID gone, we may expect STD rates to go up, and then these positions are going away. So it just seems like our workload and manpower capacity may be out of sync here.
So again, thank you. That completely understand your point. So again, with these funds, as Director Tilley has explained, I think before, the disease investigation that's traditionally done by those investigating STDs is the same practice that was needed by COVID-19. So a lot of these funds allow us to flex up and down so we can continue our traditional work around STDs, and then as COVID variants come in and out, as we see happening, throughout the last 2 years, and as the papers are reporting now, this will give us the flexibility to staff up and down as needed, but it won't take away from our traditional work around STD investigations.
All right, thanks for the answer. Thank you, Madam Chair.
Yes, no problem. Okay, we now move to tab 11, FIS 22105, request from the Department of Transportation. Are they hiding out there? Oh. Yes, you were hiding out there.
Hello, Marie Mullen with the Department of Transportation.
Okay, we have to actually vote on this because it's not on the consent calendar. Are there any questions regarding the transfer of this money for winter maintenance? We're actually happy that winter maintenance is almost over. We hope. Okay, seeing none, could I have a motion, please?
Move to approve.
Senator Daniels and Senator Gray. Was that correct? Okay. Will the clerk please call the roll?
Roll call 22105. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Yes. Senator Daniels.
Yes.
Senator Gray.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9-0.
Vote being 9-0, FIS 22105 is approved, and that's probably the easiest time you will ever have here at Fiscal. Okay. We now turn to tab 12, FIS 22110, a request from the Judicial Council for $2.3+ million from funds not otherwise appropriated. Pardon?
I'm still alive.
Good morning, Madam Chair and committee members. I'm Sarah Blodgett, Executive Director of the Judicial Council, with Nina Gardner, the Chair of the Judicial Council.
Amazing who shows up, huh?
Right.
Okay. Are there any questions for Ms. Blodgett? Okay.
Thank you. Can we expect that these salary increases will have to be made permanent and will be rolled into the next budget?
Thank you.
Will it be really temporary?
Thank you for that question, Senator Rosenwald. This request is quite unique, as I'm sure all of the committee members see. And one of the reasons that it is so unique is the recent formation of a union at the Public Defender Office. And we really have just started that process. There is no agreement in effect. Negotiations have not even begun. So our next request for the upcoming biennium is going to depend on those union negotiations. So it is certainly possible that what will be included in our request, but at this point, we just can't say.
Thank you.
Are there any further questions? Yes, Senator Daniels.
Thank you so for clarification, we're using one-time money, but your answer is you're not sure if it's going to be for ongoing expenses or not.
Thank you, Senator Daniels. That is exactly correct.
Okay, thank you.
Are there any further questions? I just have one quick statement that I think everyone knows the public defenders are in very bad shape. Not physically, but fiscally. And so this is extremely important to try to keep the public defenders we have and hopefully be able to hire some new people. So
Thank you, Madam Chair. And I did just want to mention that we have had incredible support during this crisis from the Governor's Office, from the Supreme Court, and from the Department of Justice. We're very lucky to have such wonderful partners in this.
thank you. Could I have a motion, Senator Rosenwald? Second by Representative Erf. Will the clerk please call the roll?
Roll call 22-110. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Wallner. Senator Daniels.
No.
Senator Gray.
Yes.
Senator Gaida.
No.
Senator Rosenwald.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 7-2.
On a vote of 7-2, FIS 22-110 is approved. Thank you very much for coming in.
Thank you very much, Madam Chair.
Okay, we now turn to the miscellaneous items. And I understand we have a request from LBA to hire someone.
Yes. Thank you, Madam Chair, members of the committee. Pursuant to the administrative procedures of fiscal, when the LBA office wants to fill a position, they need fiscal approval. We actually had a recent vacancy. We had someone move over to the Department of Safety to help out with road toll. Our auditors were able to find someone, a current student at UNH, that has agreed to join our office contingent upon fiscal approval after graduation in May. So we would ask for your approval to fill that position.
Could I have a motion to approve the hiring of
Financial auditor.
a financial auditor?
So moved.
A second. Senator Daniels and Senator Gaida? Okay, I'm very happy that someone actually came in with a prospect prior to asking for hiring. So thank you for that work. And if anybody else needs financial auditors out there, you can chat with Mr. Kane and he can give you some pointers on how to hire those people. So, okay. Oh, what? We need to vote.
Okay, you want roll call?
Oh, I guess we don't need a roll call, do we?
It's up to you. It can be
No.
voice or roll. Yep.
Okay, all those in favor, please raise your hand. Opposed? Motion passes.
9-0, okay.
Thank you.
I think there are only 8 of us here since Earth went out, probably to the bathroom. Okay, the next item that I do have a question on is the Department of Education on FIS 22092. This is preventing childhood lead poisoning and paint from water quarterly report, blah, blah, blah. Okay. I read the report, and my only concern is that it doesn't appear that all schools are cooperating in this testing. And I just want to know, A, why? And B, what are you doing to fix it?
Sure. So for the record, my name is Amy Clark, and I'm with the Department of Education and School Facilities, and I brought along with Brandon Kernan.
Hi, and I'm the administrator of the Drinking Water and Groundwater Bureau at the Department of Environmental Services.
Great, okay.
So we work collaboratively together on this item, obviously, and the report, it looks like non-compliance, perhaps, but it was the results of the testing that I think that you're looking at. So on that table in Appendix A, so keep in mind the standard is at 15 parts per billion, which requires schools to remediate for lead. And these are the results of those samples. So what it's saying is 36% of the schools tested exceeded the limits, but then they were required to remediate. And so we actually have almost 93% of our schools reporting those results to us.
Yeah, I got that.
Okay.
But what about the 7% that aren't reporting? And what are you doing to fix that?
Great.
Sure. There's a lot of work ongoing right now to improve the management of this program. Essentially, there was a law passed in 2018 that required these schools to sample without a system in place and without a budget in place at the time. We since received EPA grants, pretty substantial grants, and developed work plans that involved hiring a contractor to administer and outreach to the schools, and also a temporary part-time position. Unfortunately, right when those got approved, COVID occurred, and there was sort of a freeze on new contracts and also hiring new staff until people kind of figured out the consequences of COVID at the time. Since that time, we have hired the person who's now developed the RFP. We've hired a contractor, and they are now proactively outreaching to these schools, letting them know about the statutory requirements to sample and to mitigate if there's exceedances. And so that work's ongoing. There's a database dashboard being developed so the public, in a very transparent way, can see what schools have sampled, which ones have issues, and which ones have addressed the issues. And so essentially there's been a couple-year delay, but the program is very much on its way to gaining compliance. I should note that sort of parallel to all that, and again, this is largely a lot of outreach and voluntary compliance with schools. There's not a system in place for enforcement. There are legislative initiatives underway that address this area of statute. One is Senate Bill 452, which is still in the Senate. I believe it goes to Finance next. And the other is House Bill 1421, which was heard by the Senate Education Committee this year. Combined, they substantially change what's in the statute to essentially create a pretty overarching regulatory process for schools to comply with. And when we talked with the Education Committee this week, DES really painted a picture of what could happen if both House Bill 1421, which seems to have pretty broad support, and Senate Bill 452, if they in tandem were both to pass. One lowers the standard from 15 to 5, so you have a lot more non-compliance, like double the number of non-compliance, which might be appropriate, but it creates work. And another provision of one of the bills, House Bill 1421, would actually require that we administer these requirements and fine people if they don't comply. And so we painted a picture to the Education Committee whereby we would be regulating 1,500 entities between schools and child care facilities, 20 to 30,000 sampling points, because every fixture that's available for drinking water has to be tested and tracked, and just told them what it would take, sending out sampling schedules, requiring samples, processing samples, doing violations if samples aren't collected, doing violations if you don't mitigate samples. A really big regulatory regime for entities environmental services usually don't work with, schools that buy water from a water system. So we suggested that we have a work session, and Senator Wards was receptive to that and asked DES to prepare some materials to look at maybe another path. The thought being that in schools, especially in child care facilities, people aren't going to every single sink generally to get their drinking water. There's water fountains and bottle fill-up stations. So using available grant programs or to get more grant funds to maybe establish a program where schools really focus on having points of for people to get their potable water, and that those be tested, and that those bottle fill-up stations be state-of-the-art, and maybe go even beyond lead and have ability to filter other things, as a way to maybe give schools and child care facilities a more streamlined process to make sure their water meets standards, opposed to tracking 20 to 30,000 sampling points at these facilities where people might not be drinking from the janitor's faucet, or the sink in the English room. So Senator Ward just asked us for more information on other ideas, and we're preparing that this Wednesday. So we have 2 tracks going: 1 to gain compliance with the current statute, I guess 3 tracks. 3 to create a comprehensive regulatory regime, which DES thinks we have a lot of concerns about, and we think the regulated entities will have a lot of concerns about if it got into place. And then maybe a third option that's really just focusing on the points where people drink their water and making sure that water is really safe to drink.
Okay, so is that going to, your third point, is that going to get into a amendment?
Yes, I believe that's Senator Ward's intention. She asked us to combine 1421, House Bill 1421 and Senate Bill 452, which again, when put together, have a lot different effects than apart, and then to work in this third option as well, so that there's not this whole new regulatory regime that's created.
Senator Rosenwald?
Thank you. My question is, of the $1.6 million that we appropriated 4 years ago now, or 3.5, has only $144,000 been encumbered? And if so, why so little when a third of the schools are testing above the allowable amount?
So those numbers are correct. A large part of it has to do with, one, there's been no system in place and no staffing in place until the last 6 months, really, to reach out to schools and connect them with the results and to the available funds. Another option might be that these are fixtures that aren't really used for potable water, and so they put up a sign instead of applying for a $5,000 grant or something to mitigate it. The data you see here is pretty coarse. What we really can't connect those results to is exactly how often those sources are being used for drinking water at this point. And that's what's being fixed with Trupani, the contractor that's now been hired, and then the temporary part-time position. The data is going to mean a lot more over the next year, and you're going to see a lot more use of those funds. And we may go back to the trust fund and ask them to change those parameters to also allow child care facilities to be eligible, because they have to comply with this requirement. Right now only schools can, and maybe to even entertain these bottle fill-up stations, focus points of drinking water, opposed to mitigating only fixtures that are over the action level.
Representative Emmerich.
Thank you, Madam Chair. Would I be naive to think that a town, I live in Hampton, we have a private water, but it's for the whole town. Would I be naive to think that if you just tested the water supplier, you wouldn't need to test every location in every school?
For most contaminants, your suggestion's correct, but not for lead. Lead is a plumbing-based contaminant. It comes from the pipes and so, or fixtures.
Okay, thank you.
Yes, Representative Edwards.
Thank you, Madam Chair. As I understand it, we have a compliance problem with children being tested for lead poisoning. You may know that there's 2 age points where they're supposed to get lead tested, and one is very early after they've been born. The other one's, I guess, before they go into the school system. Are you the right people to work with the DOE to develop an educational program for parents, intended for parents, so that parents know why they should seek out lead poison testing for their children? Or who might be accountable for developing testing that would make our public smarter about why we want them tested?
The Department of Health and Human Services has a whole program that oversees the childhood testing, and so I don't know if anyone here is able to speak to that from HHS, but it's certainly that agency that takes the lead. And they collaborate with us, to the extent they have a child with high blood levels, they'll work with us to get the water tested, and I'm sure if it's a school concern, they'd work with the Department of Education, but they definitely the lead.
And I just want to say, with the Commissioner of Education in here, one proposal that we have in legislation is to expect the schools to be more of an enforcer on parental compliance with lead testing, and I'd much rather see us go down the education role than the coercion role.
Well, that's why they're getting Canva. Sorry. Okay, are there any further, I had no idea this was going to open up so much information when I asked my question, but I really thank you for that and for your work. And I know that sometimes getting non-state agencies to cooperate and to do the things they need to do is difficult. So keep on them. Okay, thank you. Oh, I'm sorry. Yes, go ahead. Pull your microphone closer.
My first question is, how do they remediate this? Because there's miles and miles of plumbing in these schools, and do they go through you to get a grant to remediate the problem?
To remediate the problem, there's several options. You can often replace an older fixture. Older plumbing components are allowed to have more lead in the wetted area of the fixture, so that could be an option. You could also put an inline filter that removes the lead as well. And then, yes, there is right now a grant program that pays 50% of the remedial costs for schools, not for child care facilities, and the Department of Education administers that.
The administrator. Thank you very much.
Okay, thank you. Oh, wait, we've got one more question.
Thank you, Madam Chair. Can you clarify whether there's any legislation coming forward to add child care facilities to this program?
It's already there.
The statute requires child care facilities sample, but they don't have access to the $1.6 million grant right now from the trust fund. And so, yeah, we are working to find options. It could be that we go back to the trust fund, which is legislators and appointed members of the public, or potentially there's ARPA dollars allocated for drinking water that we might be able to use. And then even Health and Human Services has some options, and they're the ones that oversee child care facilities that might be able to help with that.
So is there any legislation coming forward to address the fact that they can't access these funds, the drinking water funds?
Not at this time. I don't think the mechanism is necessarily a legislative action, though. I think it's tweaking or making decisions with available funds.
Thank you.
Okay, can we move on? All right, thank you very much. The Governor's Office for Emergency Relief and Recovery provided us last month with the status of CARES funding, and this month he's going to talk to us, they're going to talk to us about what goes on with ARPA, what has gone on with ARPA. Welcome back.
Happy to be here.
I knew it.
It's getting nice outside, I think.
Yeah.
Again, good afternoon, everybody. I think we wanted to come back. Last month, we got a chance to talk a little bit about CARES Act and sort of where things stood with that. Wanted to come back today and give you sort of an update on where things stand with the ARPA funding. And in particular, the portion that Gopher has a good degree of involvement with, which is with the state and local fiscal recovery fund dollars, which I can get into a little bit more as we go along here. A couple of things. First, with regard to dates and importance and timeline, because this is obviously setting a little bit of the stage for where we are with ARPA. And again, and I'll mention this again later probably, is the fact that this is a program that is fundamentally different from the CARES Act. CARES Act funds were really there for relief purposes. These funds have been provided in the context of recovery. And if you sort of take a moment to think about what that distinction is, it does help drive some of the types of projects that we're seeing coming through and that you all are seeing as they get to you. The American Rescue Plan was signed into law just about a year ago, March 11th of 2021. And then subsequently in May of 2021, we got what's called the interim final rule, which was a document of about 40 or 50 pages that gave us a good sense in terms of where the general funding should be used, how it should be used. Different buckets and expenditure categories were provided and laid forth sort of the reporting requirements that were going to go with these resources. We've been and we continue to operate under the IFR. In January of this year, Treasury came back with the no longer interim final rule, but the final rule, and that document exceeds 400 pages and gave us a significantly more detailed sense of where these funds, how they expect us to report, and the data that they need in order to complete the program, and so on and so forth. And we've spent a good amount of time going through all of those. And I will say that, in the most part, that's a lot of what you see coming to you are projects that are fitting these increasingly new categories and reporting requirements. And lastly, of course, as you all know quite well, there are two important dates with all ARPA projects, in that the first is December 31st, 2024. That's the date by which we have to obligate these resources under Fiscal Recovery Fund. And then December 31st, 2026, which is the point at which we have to have spent all of those resources. Again, going, as I mentioned, the state and local fiscal recovery fund, this is one portion of the American Rescue Plan funds that have come to New Hampshire. I mentioned that we are certainly subject to all the federal regulations under this program. The total that has been designated by the federal government under, again, FRF, is specifically $994,555,878. And we are, I think, in your documents that we provided, it gives you an update as to where we stand in the obligation of those resources at this point. A lot of the major requirements that I mentioned under the federal guidance, under federal rules, define specifically the types of eligibilities. They generically fall under categories like public health, negative economic impacts, and infrastructure. Everything that we provide and everything that that we end up getting approval to move forward with has to fall in and align with these expenditure categories that are lined out in the final rule. I would also mention that in every case, these funds, well, in some cases it depends on the level of the expenditure, but in almost all cases, federal procurement rules are required to be followed, as are federal labor laws, things like Davis-Bacon, and environmental rules. All need to be complied with by the end user of these funds, I should say. And I did mention the deadlines. That shows up many times here in my notes. Gopher's responsibility primarily in a lot of cases has been both to do the reporting and the data analysis and all of the required submissions to the federal government. But we also work very closely with all other state agencies and with other recipients of these resources on a regular basis to make sure that the data they're collecting is adequate and it's going to meet the reporting requirements. And there's a lot of work that goes into that end of the business. As I mentioned, there are a number of programs that you are seeing requests for as we go through here that are not specifically under the state and local federal recovery funds. I thought I'd mention a couple of those. The rental assistance program that we've talked about many times is separate from that. The capital project funds, which we will start seeing some more activity over the next couple of months. This is primarily the broadband funding that is available. That total allocated to New Hampshire that we have not yet deployed is $122 million under the Capital Project Fund. Again, that's separate from these FRF dollars. The Housing Assistance Fund, this is a program that we talked about, I think, just a few weeks ago, and is just now getting started up to assist for homeowners as opposed to rentals. And then it also does not include all the funding that will start flowing under the infrastructure bill that Congress passed subsequently, and that's obviously going to be run primarily with the Department of Transportation. So as that money starts to flow, I imagine we'll see Commissioner Sheehan here more regularly as well. And of course, HHS has also seen a significant amount of resource that they're putting forward toward a number of different obvious public health and health related and vaccine programmings. On the where we are right now, of course, we provided you the most recent update as to the list of the programs that have been obligated and approved here at Joint Fiscal Committee. They're really falling into a number of pretty large categories. There's obviously the water and sewer infrastructure. That was done pretty early on. Now, most of that, at least under FRF, is being run by Department of Environmental Services. Those funds, as you'll recall, we moved pretty quickly just because of the time horizon that is necessary for those types of projects. And, you know, that we do have to have this money spent by 2026, which seems like a long way away unless you're trying to permit and move a lot of these projects all at the same time. Mental and behavioral health obviously continues to be an area where you're seeing a lot of these programs. The COVID-19 response, at least so far, has been a continuing number. We hope that we're going to continue to see those numbers start to fall off a little bit. And then, of course, in the economic relief and development area. Gopher is in the context of, in addition to all the reporting that goes on, we spend a significant amount of time reviewing proposals from different agencies and from other parties around eligibility and the cost of those programs, and looking for areas where there may be duplication and overlap among existing programs that we seek to avoid. As you've heard me say many times, the primary function and purpose of these dollars, hopefully in most cases, is to be able to make those like one-time investments in initiatives and programs and infrastructure that are going to carry us forward for a long period of time, and not necessarily get the state into a position where we're going to have ongoing operational costs as a result of these investments. And of course, as you well know, everything that ends up making its way through that process, we end up talking about in one form or another here in this forum. So that's kind of where we are right now. And of course, I'm always any questions that you might have. And I just wanted to say, we certainly appreciate all of you working on these items as they come through on a regular basis. And really appreciate all the time that you're putting into taking a look at what we've been able to do, at least thus far.
Are there any questions? Yes, Senator Daniels.
Thank you. In addition to the mandates that come from EPA regarding water and wastewater, are there any other mandates that ARPA money could cover?
I guess, are you talking about regulatory mandates that?
Right, I'm saying like in our town, we're looking at $8 to $10 million worth of federal mandates that are placed on us for water or wastewater. And so I'm always looking at what the federal government is placing on us for mandates and asking, are they supplying the money? Well, in this case here, some of the money is being supplied, and we may be able to use that water and wastewater money that comes in to take care of some of those mandates. But on the other categories that you have identified, I'm wondering if there are any other mandates in there that we could go back and tell our constituents we've got federal money that's going to cover that.
Well, I guess it would be hard to say without knowing specifically the case, but I guess what I would say, Senator, is that we are not seeing that there is necessarily relief from those federal mandates in the use of these funds. So in those instances where DES is having to move these resources out into our communities for water and sewer upgrades or projects, we continue to have the same requirements and permitting requirements that are required both by the state and the federal government. And in fact, you might recall, I think we had an item some time ago for DES to add staff for the permitting office specifically for that purpose, and that this was going to generate some additional pressure on that office to move those projects quickly.
Thank you.
Are there any further questions? Yeah, yes, Representative Wallner.
Thank you. I did notice in a in a couple of categories, there are, you refer to personnel costs. Can you talk a little bit about how you're using these dollars around personnel? I know the workforce is really an issue for so many areas.
Well, I mean, leaving the workforce issue aside and finding people to fill these positions, which is another issue that I know you've talked about already today. I was going to ask Michael Kane where he was getting his person from. You know, and how much are you paying them? But to your question, all of the requests that are coming through for these types of funds for staffing, my department, my other department included, are for 9T positions. So these are temporary jobs that are tied to the funding that ultimately they'll be dealing with. So the intention is not to necessarily extend beyond the life of the ARPA funds with these dollars for the temporary staff that typically is coming in front of you.
I just have a follow-up.
Yes, please.
Well, I was looking at one. It was it's on the appendix 2. It's the wage enhancement for the licensing of nursing assistants, and I was wondering about that kind of a program and how that kind of program is working.
Oh, I'm trying to remember that.
Would you mind just mentioning the item you're looking at? I apologize.
It's wage enhancement for licensed nursing assistants, LNAs.
Yeah.
Do you want to?
I can talk to it.
Yeah.
Chase Hageman, Deputy Director at Gopher. So that's probably a poor characterization of what that program did. It was actually an amount of money given per bed at that facility that the facility could then use as it needed, and it may have used it for assisting with wages to retain or acquire staff.
Thank you.
Are there any further questions? Okay, I have a further question. I'm looking at your first page that's got the little blue thing, and it's showing that we have $497 million left, and we have 4 years to allocate it and spend it.
Yes.
Okay.
2026. Yep.
Yeah. So, when are we going to get something on the other 497 million? I mean, we're chipping away at it, but I think like today, what we have, 23 million. That doesn't chip away very much. So, yeah,
It's
well,
not as
I
easy
know.
to spend $1 billion as you might think.
But my concern is, okay, that as we start getting into, budget season next year and all of the mess that goes along with that, we on the Fiscal Committee are basically all tied up in that stuff, and I know that, the people in the various departments are starting to think about preparing budgets, and
Yeah.
you know, I'm just concerned that we need to try to figure out
How to spend it quicker.
where we are, and I guess if I could say, if anybody has any wonderful ideas, they can either talk to Commissioner Caswell or myself, but you know, you understand where I'm coming from.
Yes, ma'am.
And no, we cannot give it to each one of us for enhanced salary for our positions.
I've already tried that.
Yeah, good, okay. Are there any
Even if
further-
we doubled it, I'm not sure that would spend much, man.
I think you're right. Are there any, yes, Representative Wallner, you're looking for the pay raise?
No, I'm not looking for the pay raise. I
Oh.
think we're paid adequately here, $100 every year. I was wondering, so you're setting aside money for each of these projects.
I'm sorry.
You're setting aside money for each of these projects, or
Yes.
funds for each of these projects. But as we get closer to 2026, some of these projects probably won't spend down
Yep.
all that you set aside.
Yep.
So there will be some funds left. Will the federal government allow us to have any access to those funds after 2026?
I'm not sure there's been an official answer to that question, but to your point, in a lot of cases, particularly in the larger number cases that we know are going to go on for a period of time, we actually build in an expiration date in the contracts well before we get to the end, with the ability to extend. But it gives us that opportunity to make sure that we're not just leaving everything until December 30th, 2026 and saying, let's see how much we got left. I mean, we don't want to be in that position. So, yeah, we're very cognizant of that, and under very specific orders to make sure we don't leave any money on the table if we can.
That's why we had that CARES Act thing. That, you know,
The waterfall.
Yeah, we got a little close to the end on that.
Yeah.
And making sure that we got that money approved.
That was like an 8-month program, remember, initially.
I know.
So, yeah,
I know.
we already didn't have a lot of time for that money.
Okay, thank you very much. I appreciate it. And I know that if anyone has any questions, they can always give you a call.
Absolutely.
Okay, thank you.
Thank you, Representative.
I would like to point out, just before we have just a couple things to finish up, but we are going to be asking the departments to come in and talk to us about their ARPA funds that have not come through Gopher. And there are lots and lots and lots of dollars out there. And we're going to be starting next month with HHS and DES coming in to talk to us about that. Because I think that, you know, we as the keeper of the dollars, so to speak, need to be sure that we are holding our folks responsible for that money. So we'll see what happens, you know, but we'll rotate it around so that every department that's received offline ARPA money, I know that's the wrong term, but other ARPA money will be in to see us. So looking forward to that time. All right. Well, we'll see what happens. Okay. Let's see. I think our next thing is audits. Is that correct? Yes.
Yes.
Always our favorite time.
Ours true, excuse me, ours too, Madam Chair. Good afternoon, members of the committee. For the record, Steve Smith, Director of Audits. And with me here, our first report is the lottery. Oh, there's Charlie. Okay. And Kim Bisson is going to present the management letter as a result of our financial statement audit for fiscal 21. And joining me is Director McIntyre and Jim Duras, the CFO, for any questions that the committee may have.
Good morning, Madam Chair and members of the committee. Again, for the record, my name is Kimberly Bisson. I'm here today to present the management letter, which is a byproduct of our audit of the lottery's fiscal year 2021 financial statements, which were previously presented to this committee at the January 21st meeting. If you turn to the table of contents, you will see that the report includes 3 internal control comments, one of which is considered to be a material weakness. The lottery concurs with all 3 comments, and none suggests legislative action is required. The observations begin on page 3. Observation number 1 discusses several deficiencies in internal control, which combine to result in a material weakness in the lottery's sports betting revenue and contract monitoring processes. To address this, we recommend that lottery take steps to formally document its policies and procedures covering the major areas of its sports betting operations, and to amend its contract to require the sports betting vendor obtain a service organization control report specific to New Hampshire Lottery on an annual basis. We also recommend that lottery implement policies and procedures to assess risks related to outsourced services, including identifying when service organization control reports should be written into lottery contracts. Turning to page 7, observation number 2 recommends the lottery enhance its financial accounting and reporting staff by establishing a director of finance or similar position in order to support the ever-increasing scope and complexity in lottery operations and to mitigate the risk of relying on the performance of one employee for all financial accounting and reporting activities. Additionally, lottery should take steps to formally document policies and procedures that address the significant aspects of its financial reporting process, including but not limited to the development of significant accounting estimates, completion of monthly reconciliations, preparation of year-end adjusting and accrual entries, and the compilation of its annual comprehensive financial report. Finally, observation number 3, beginning on page 9, recommends that the lottery's administratively attached counsel for responsible gambling implement formal policies and procedures to ensure all invoices are adequately supported in accordance with contracted terms, and ensure duties within the council are appropriately segregated to allow for an independent review of invoices prior to submission to the Lottery Commission for payment. It should be noted that the council also concurred with this comment. The appendix located behind the tab on page 11 reports the current status as of December 16th, 2021 of observations contained in the fiscal years 2020 and 2019 Lottery Commission management letters. As noted at the bottom of page 13, 7 comments were resolved, 1 was in the process of remediation, and 1 remains unresolved. Page 14 reports the current status of fiscal year 2019 comments resulting from the work of an IT specialist engaged to perform a review of Lottery's IT systems. As noted at the bottom of the page, 2 comments were resolved and 2 are in the process of remediation. This concludes my presentation. I would like to thank Executive Director McIntyre and Lottery staff for their assistance and cooperation during the audit. And with your permission, I will now turn the presentation over to Lottery.
Excuse me.
Thank you and good afternoon. My name is Charlie McIntyre. I have the privilege of being the director of the New Hampshire Lottery. And with me is our Chief Financial Officer, Jim Doris, as previously noted. I'd like to thank the folks at the LBA staff, as always. A thorough audit, and the recommendations they have forwarded are already being implemented as we speak. So happy to answer any questions you might have.
Does anyone have any questions? The only question I have is, do we get feedback on when these things are corrected?
Well, certainly, we're audited every year, and so they'll be back probably next month or June. So I always say, how can I miss you if you never leave? And I say that kiddingly. But certainly, they'll be back in June for their audit. And so, like for example, the SOC 2 report request, I've already signed an agreement with DraftKings. They'll have that. It's already being implemented as we speak. So, as you can see, 3 findings is not bad. And one of them is not me or us, really. So I think 2 is pretty good. But yeah, if you want a separate update, Madam Chair, I'm happy to do that for you. But they're back in June, so they'll keep tabs on us.
Yeah, I guess we just, and maybe, I don't need anything really formal. I just want to make sure that on each of the audits that we are making progress and not just letting it hang around.
Yes, if I may, Madam Chair, as you know, we audit the Lottery Commission every year.
Right.
So you have 3 years' worth of observations in front of you with the status of them. So, for example, the 2019, when we come back in for the fiscal 22 audit, fiscal 22 audit, if those remain unresolved, more than likely they're going to make it into the body of the management letter next year. So we evaluate as what the status is based on working with the commission. So in this particular case, we won't let them just fall away without.
Well,
So
because there was one that you said, nothing had been done on it, and that was from 2 years ago or something, a year ago.
Oh, sorry.
It's okay. No worries. Yes, that actually was specifically to our sports betting vendor partner not providing a SOC 2 report. I signed an agreement, a change order with them, I think in January. So going forward, we'll be getting that every year. So that's the one that was unresolved. And that had to do with DraftKings changed out a significant portion of its business. It had previously contracted for market creation services through a company called Canby. They ended up buying a company called SB Tech, so they changed out the transmission while the car was still running, essentially. So getting a SOC 2 report previously wouldn't have made sense.
Okay, thank you. All right, appreciate it, and keep up the good work, and keep sending money to the Education Trust Fund.
Doing our best. Thank you, Madam Chair,
Okay.
members of the committee.
Our next management letter is for the Liquor Commission. And joining me from our office is Jim LaRiviere. He was the manager on this audit this year. And joining us from the commission is Chairman Malika and Tina Demers, CFO.
Good morning, Madam Chair and members of the committee. Again, for the record, my name is Jim LaRiviere. We are here to present the management letter, a byproduct of our audit of the Liquor Commission's fiscal year 2021 financial statements, which were previously presented to the committee at the January 21st meeting. If you turn to the table of contents, you will see that the report includes one internal control comment, classified as a significant deficiency. The Commission concurs with the comment, and no legislative action is required relative to this comment. The observation on page 3 identified where significant errors detailed in items numbers 1 and 2 of the observation were made, detected, and corrected, but lacked documentation explaining the cause of the errors and the adjustments made to correct system accounting records, and lacked evidence of management's review and approval. We recommend the Commission establish formal policies and procedures for adjusting system accounting records. The policies and procedures should detail the processes to be performed, who performs each process, and addresses adequately documenting the error and corrective actions. All adjustments should be reviewed and approved by an appropriate level of management, independent of the posting and correction process. The appendix, located behind the tab on page 5, reports the current status as of December 17th, 2021, of the observations contained in the fiscal year 2020 and fiscal year 2019 Liquor Commission management letters. As noted at the bottom of page 8, 10 comments were fully resolved, and 8 comments were in the process of remediation. This concludes my presentation. I'd like to thank Chairman Mullica and Chief Financial Officer Tina Demers and the Liquor Commission staff for their assistance and cooperation throughout the audit. With your permission, Madam Chair, I'd like to now turn the presentation over to the Liquor Commission's Chairman, Chairman Mullica.
But before you do that, can I just ask a question on the finding?
Certainly.
You show 2 examples here of one of 48 million and the other one of 1.4 million. And then you recommend that every error should have some sort of supervisory signature on it. And I don't know that I would hope that we would give the Liquor Commission people some sort of authority, without going up the chain, for, some amount of money that, there's an error, it could be a typo, it could be something else, but I would certainly think that, if I made $1,000 error that I caught at the end of the month, I should be able to fix that without going 3 steps up in supervision. Where if over time I find that I've got a $1.4 million thing, then yes, I think we need to check that out and figure out what's going on in our processes. So I just ask that the comment that says everything needs to be approved, that we just look at that between the 2 of you to figure out what does that really mean. Because I don't think we want to do a $25 error. Okay? So that's dealing with the audit and, what you've come up with. So thank you, and I'll let you guys work it out. Okay? Whatever it is.
Okay. All right, thank you.
Please.
Good morning, Madam Chair, members of the committee. For the record, Joseph Mullica, Chairman of the New Hampshire Liquor Commission, and CFO Tina Demers is with me as well today. I'd like to thank the LBA for their fine work. They've always done a great job, and we appreciate them coming in and looking at our organization to make sure that it's running properly. But Jim and Steve and Jean, we appreciate their work. Most importantly, I'd like to note that I appreciate the work that Tina, our CFO, and her staff does. Because in 19, we had 12 observations, and today we only have 1. And that's due to the work of Tina's organization and everyone that works for Tina. I'd just like to have that on record. Thank you, Madam Chair.
Absolutely. And I have one request from you. I don't know exactly when I was reading it or where I was reading it, but in your audit, it says everything is being fixed by the risk management plan. And I would like a copy of that risk management plan so that we can see where that's going. And that's all.
Absolutely. We'd
Okay.
be happy to provide that to you,
All right,
Madam Chair.
thank you very much.
Thank you.
Okay. You're done? Everybody's done?
Yes, ma'am.
Including us? No, okay. Representative Emmerich.
Madam Chair, I would move to accept both audits, place them on file, and release to the public in the usual manner.
Do I have a second? Thank you, Senator Daniels. All those in favor? Aye. Opposed? All right, motion passes. Now, they tell me that I'm supposed to set the next meeting. Is that the last thing I have to do?
Yes.
Which I forget to do most of the time. So, looking at what we normally do, our next meeting would be on April 15th, which is tax day. And I know everyone has done their taxes, so, except for me. So, without any objection or whatever, we'll plan on it for April 15th of whenever, April 15th. So is there any other business to be brought before the meeting? Seeing none, can I just adjourn? There you go. Thank you very much.
Okay.
Oh, why?
Here's that report you just asked looking for.
Oh,
It's on your email too.
yeah, thank you very much. I know you got word of this ahead of time, but I really do appreciate it.
I'll swap you.
Oh, I'll take that. Not thank you very much.
I've got the, for the meeting at 1:30.
Okay.